Welcome, fellow health enthusiasts. Today, we embark on a captivating journey into the realm of CBC interpretation, using the lens of red blood cell count as our guide. Today, we'll focus specifically on the red blood cell count, a crucial parameter that sheds light on the tireless heroes responsible for delivering oxygen throughout your body. We'll delve into the significance of red blood cell count in the CBC report, how interpretations of this parameter can guide potential diagnoses, factors that can influence red blood cell count and their implications. So, buckle up and get ready to unlock the secrets hidden within your red blood cells. Let's begin our exciting journey together. Here's a concise introduction to red blood cells, aiming to simplify the understanding of their count and its implications. Red blood cells are generated in the bone marrow through the assistance of various elements, including metals such as iron, cobalt, and manganese, vitamins like B12, B6, C, E, folate, riboflavin, pantothenic acid, and thiamine, and amino acids. The process of erythropoiesis, or RBC production, is regulated by hormones like erythropoietin, thyroid hormone, and androgens. The biconcave shape of erythrocytes results in a central pallor on blood smears, typically occupying less than 1/3 of the cell's diameter. Such cells, containing the standard amount of hemoglobin, are termed normochromic. Mature red blood cells, also known as erythrocytes, transport oxygen bound to the iron within hemoglobin. Despite lacking a nucleus and the ability to synthesize protein, mature red blood cells possess limited metabolic activity, allowing them to survive for approximately 120 days. Factors influencing the quantity of red blood cells include age, gender, altitude, physical activity, dietary habits, environmental pollutants, medication usage, tobacco, nicotine consumption, renal function, and overall health status. Clinically, the significance of this test lies in its ability to measure the blood's capacity to carry oxygen. Normal red blood cell count may vary at various ages. Newborns have 4.1 to 6.1 million per millimeter cube. Children may range from 3.6 to 5.5 million per millimeter cube. Male adults may range from 4.6 to 6 million per millimeter cube, while females' normal limits are 4.2 to 5.0 million per millimeter cube. During pregnancy, RBCs are slightly lower than normal adult values. Now we will be discussing the main part of this presentation: causes of decreased red blood cell count levels. Broadly, there are 4 causes of decreased RBC count which may be classified as: Number 1 is impaired red blood cell production. Number 2 is increased RBC destruction, mainly due to hemolytic anemias. Number 3 is blood loss. And number 4 is fluid overload, which may be due to hemodilution. Decreased RBC count due to impaired production, mainly due to disturbance of proliferation and differentiation of stem cells. This may be due to pure red cell aplasia, aplastic anemia usually affecting all kinds of blood cells. Fanconi anemia. It is a hereditary disorder featuring aplastic anemia and other abnormalities. Anemia of renal failure due to insufficient erythropoietin production. And anemia of endocrine disorders. Decreased RBC may also be due to disturbance of proliferation and maturation of erythroblasts. This may be due to pernicious anemia or macrocytic anemia due to impaired absorption of vitamin B12. Anemia of folic acid and vitamin B12 deficiency. These both are often referred as megaloblastic anemias. Then there is anemia of prematurity, caused maybe because of diminished erythropoietin response in premature infants. Iron deficiency anemia resulting in deficient heme synthesis. Thalassemias causing deficient globin synthesis. And anemia of renal failure because of erythropoietin deficiency. Other mechanisms of impaired RBC production are myelodysplastic syndrome, anemia of chronic inflammation, myelophthisic anemia or myelophthisis, which is a severe type of anemia resulting from the replacement of bone marrow by malignant tumors or granulomas. 2. Decreased RBC count due to increased destruction, mainly due to hemolytic disorders. Intrinsic or intracorpuscular abnormalities where the red blood cells have defects that cause premature destruction. These may comprise of hereditary spherocytosis, a hereditary membrane defect, causing RBC to be sequestered by the spleen. Then comes hereditary elliptocytosis, which is a defect in membrane skeleton proteins. Abetalipoproteinemia, causing defects in membrane lipids. Next followed enzyme deficiencies like pyruvate kinase and hexokinase deficiencies, which cause defective glycolysis, and glucose 6-phosphate dehydrogenase deficiency, causing increased oxidative stress. Hemoglobinopathies causing unstable hemoglobins and comprise of sickle cell anemia. And last in the list is paroxysmal nocturnal hemoglobinuria. Extrinsic or extracorpuscular abnormalities causing decreased RBC count comprise of antibody-mediated warm autoimmune hemolytic anemia is an anemia caused by autoimmune attack against red blood cells, primarily by IgA. It is the most common of the autoimmune hemolytic diseases. It can be idiopathic, drug-associated or secondary to systemic lupus erythematosus, or a malignancy, such as chronic lymphocytic leukemia, CALE. Cold agglutinin hemolytic anemia, which is IgM-mediated and can be idiopathic or secondary. Hemolytic disease of the newborn. And mismatched transfusion reactions. Mechanical trauma to red cells can also cause RBC destruction. The possible causes are microangiopathic hemolytic anemias, including thrombotic thrombocytopenic purpura and hemolytic uremic syndrome, disseminated intravascular coagulation or DIC, various infections including malaria, prosthetic valve or heart surgeries. Decreased RBC count can also be caused due to blood loss. This may be due to trauma or surgery, causing acute blood loss, gastrointestinal tract lesions causing chronic blood loss, gynecologic disturbances generally causing chronic blood loss. Hypervolemia causes spurious low RBC count due to hemodilution. Causes of high red blood cell count. Polycythemia vera, often a hereditary problem. Excessive smoking, high altitudes, renal neoplasia when the kidneys are producing too much erythropoietin, heart failure or some heart diseases, lung diseases like emphysema, pulmonary fibrosis, dehydration, erythropoietin doping by athletes to boost their performance, hemoglobinopathies, adrenal cortical hyperfunction, and anabolic metabolism. We've covered the interpretation of red blood cell count along with all the factors affecting its increase and decrease. Stay tuned for my next video, where we'll delve into hemoglobin interpretation and its associated causes. Don't forget to like, share, and subscribe to my channel if you haven't already. See you soon.